this all sounds pretty frightening, doesn't it? If these radiation levels are indeed higher than that of Chernobyl, what does it mean?
Well, we know very well what happened after Chernobyl because many of my colleagues in the European Committee on Radiation Risk have studied the area of Belarus and Ukraine contaminated by these same materials extensively. So we know more or less what's going to happen there, and we know that one of the first symptoms that you will expect to find is increases in heart problems in children. And I was interested to see that you mentioned a little girl whose symptoms, the rings under the eyes and the joint pain and so on, are all quite symptomatic of heart illnesses. The Cesium-137 in Tokyo is really quite significant. We have measured concentrations of Cesium-137 and 134 in air filters in vehicles from Tokyo and from Chiba and from hundreds of kilometers away from Fukushima, from the Fukushima site. And the cesium concentrates in heart muscle and destroys heart muscle. The heart of a child is really quite small. It's a 5-year-old child would have a heart weighing about 200 grams. And probably if they remain in this area inhaling this material for a year, about 25% of that heart muscle will be destroyed and they will start to suffer from heart attacks. So these children should be taken out quite urgently, and they should be checked in hospital for arrhythmias.
But like Chernobyl, I mean, for years you couldn't go back there, could you? I mean, for years the area was contaminated and potentially fatal.
That's correct, that's correct. And in fact, in the areas around there, and in fact in Belarus, where there has been quite a high level of contamination, you have had increases in right across the whole range of spectra of ill health, from heart disease through to strokes, through to cancer, of course. And what's happened there is that there's been a change in the demographic index. So in fact more people are dying than there are being born because of the effects of radiation. It's this internal radiation that's the problem. The thing is that the Japanese authorities are applying an incorrect risk model, a model of the International Commission on Radiological Protection. And this model only really is accurate for external radiation. For these internal substances, it just doesn't work.
Again, as you heard in that piece, one of the scientists was saying that people are actually just being paranoid, but clearly he's wrong. Knowing this, what should the government be doing now to clean this up?
It's really not possible to clean it up properly. What they should be doing, though, very important, is they should be applying the risk model of the European Committee on Radiation Risk, which was developed entirely as a result of considerations of these internal radionuclides. But they're not telling the people what the concentrations of these substances are, and they're omitting to tell them a whole range of radionuclides like plutonium and uranium and substances which aren't detected by Geiger counters. And because of this, we're setting up a foundation called the Christopher Busby Foundation for the Children of Fukushima, and we will be measuring ourselves and taking samples ourselves so that we can get proper and truthful results about the true concentrations of these substances in the area. This is a very serious disaster.
It certainly is. We look forward to seeing your results, Chris Busby. Thanks for talking to us.
Thank you.
Now, heart disease is the world's biggest killer.
Thank you, sir. That was super. Thanks.
The United Nations Health Summit that begins in New York on Monday. Some patients in the developing world have turned to stem cell therapy to treat the disease, with more Veronica Pedrosa reports from Bangkok.
Well, I suffered a spinal stroke